Welcome to this episode of the ASHA podcast. I'm Fred Wyan with the American Sexual Health Association, ASHA. We're continuing our conversations on Doxy PEP, that's using the antibiotic doxycycline as post-exposure prophylaxis to prevent bacterial STIs, specifically gonorrhea, syphilis, and chlamydia. So Doxy PEP for short. And what this means is that somebody can take a 200 milligram dose of doxycycline ASAP within 72 hours after having sex. And it's really effective. If you've listened to me before, you've heard these throwing these numbers out there. But Doxy PEP can reduce the risk of contracting chlamydia by 88%, syphilis by 87%, and gonorrhea by like 55%. And last year, the CDC, Centers for Disease Control and Prevention, they put out guidelines on the use of Doxy PEP to prevent these STIs in men who have sex with men and transgender women. These are the populations that in studies saw, clinical trials saw the most success. But really, what's important is the patient experience. I mean, what's it like taking Doxy PEP? How do you even get started? So we're exploring that with a very special guest today, Maxfield Haynes, who's here to talk about their experiences with Doxy PEP and why they chose to include it as part of their healthcare regimen. Maxfield, thank you so much, my friend. It's good to see you and good to talk to you.
Great to see you too.
All right, so I'm just going to jump right in. What led you to take Doxy PEP? And I'm curious, did you start that conversation or did your healthcare provider initiate?
Yeah, so I came to Doxy PEP from a communal standpoint. I found myself in need of some sort of prophylaxis because, as I'm a non-binary individual who primarily has sex with men. And there within the confines of like a freer love system, there needed to be more ways to take care of and safeguard my own health. I've been on PrEP, pre-exposure prophylaxis, since I was 18. I remember when it first got legalized for widespread public use back in the early tens. And so I figured if there is a continuing amount of research around, uh, men who have sex with men's healthcare, then I should do whatever I can to be on top of that literature and incorporate it into my practice.
So in my intro, I kind of made the case for why Doxy PEP is important, but those are my words. I want to hear what you have to say. So why do you think somebody should think about Doxy PEP for STI prevention?
I think that Doxy PEP is one of the most amazing tools in modern medicine, especially for men who have sex with men. Just because it drastically reduces my worry about contracting something from a potentially risky encounter. And I find myself often in situations where I may not always have the ability to know exactly what the STI status or testing status of a partner may be. Say you're out at a party and you meet somebody cute dancing, and that conversation isn't always part of the lead up to whatever interaction you may have. And so as I find that if I have a tool that can help assure my own safety, I feel much more liberated to actually go and, live my life to the fullest in a way that I don't think that previous generations of queer people could, based off of the AIDS epidemic, based off of the history of where we've been.
So sometimes when you're talking about um, anything related to STIs and prevention, it can be hard to bring these conversations up, even in the medical office. And then it can be hard for providers sometimes to talk about it. So do you have any tips for somebody who's interested in Doxy PEP? How can they get that conversation started with their healthcare provider?
Yeah, absolutely. I I would suggest that you say hi. If they're your primary care provider, then they should know about your proclivities, whether who you have sex with, and what the risks are that are involved with that. And I would just say to it from a very frank and open point of view. Just say, hi, I have heard about this medication that can potentially reduce my risk of contracting an STI, and just come at it from a purely health and wellness standpoint, I think.
Let me ask you this. I'm curious. I mentioned it also in the intro about, we want to talk about the experience of taking Doxy PEP. What's that been like for you? And I'm thinking about like any side effects. I mean, is it convenient to remember? What's that whole deal been like?
My experience has been pretty smooth, I will say. I have been treated for STIs before using doxycycline and for other things just in life as they come up. And so I find that as long as I take the medication with not on an empty stomach, I'm generally fine and I don't experience any side effects. I mean, sure, doxycycline can make you sensitive to light, so you have to make sure you wear sunscreen. It also it can have some negative effects on your gastrointestinal system. But I find that in order to mitigate that, I just make sure that I eat something and then I follow I think it's the 3-2-1. Within 3 days, take two pills once. To reduce the risk. And as long as I remember that, it kind of everything takes care of itself. I haven't tested positive for an STI in over 2 years, because of Doxy. So
Yeah, that's quite a statement. What do you think we can do to do a better job of creating welcoming spaces for LGBTQ folks? And that kind of goes back to what I touched on with the previous question about, these things can be hard to talk about. Sometimes providers aren't comfortable. And I think that can be even more true maybe for sexual minorities. What can we do to just simply be more welcoming and more inclusive?
I think that we can all destigmatize it for ourselves and we can all find a little bit more comfort in knowing that sex is not a dirty thing and it is not something that we should be scared to talk about. I think that if we all collectively move towards a more communal understanding of what affects one can affect all, and kind of understand that from all sides, if we take care of something, then we can really mitigate the presence of these infections. And it is scary, yes, but I think I don't know. I have been just such an open advocate for like sexual health and testing and wellness amongst my friends. Um, so long as I can remember that, I think if we all kind of like adopt that mindset and just say, hey, we all do this. We are human beings. We love love. Love should be free. And it shouldn't be something that is shameful.
I
Uh,
love that. I think that's exactly the message we need to hear right now. You know, that really, I think you've covered everything concisely, you've covered it thoroughly, and you've hit the right tone. So, with that, I'm going to say thank you so much. Maxfield Haynes has been our guest today. Maxfield, thank you for your time. This is why we need to talk with folks like you because you're so much more eloquent and so much more credible on this topic than I could ever be. So, thank you for your time. We really do appreciate it.
Absolutely. Thank you so much for having me, Fred. This has been I have been so excited to talk about this because Doxy PEP has truly changed my life in like the most radical sense. And I've gotten like speaking from an intergenerational perspective, I talk to people younger than me, older than me, and I say, get on it.
There you go. Thank you, Maxfield Haynes. And thank you, intrepid listener, for tuning into this conversation. So check back with us often as we roll out new resources and send feedback for ideas for future podcasts. We'd love to hear from you. Info@ashasexualhealth.org is the email. And of course, follow us on all the social media platforms. We're there. So until next time, take care, everybody.